friends. So this is part one of respiratory pharmacology. And before I get started, I wanted to share a quick video clip from one of my favorite shows.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
All right, so hopefully you enjoyed that. We're going to get started with our beta 2 agonist drugs. And I always like to remind us what the term beta 2 agonist actually means because sometimes I get them confused. So remember that beta 2 is a receptor that is on your lungs. And when it is stimulated, it relaxes your bronchial muscles. It bronchodilates, lets your airways open up. And an agonist is anything that stimulates those receptors. An antagonist is anything that inhibits receptors. So for our beta 2 agonists, all of these, the mechanism of action is that it increases cyclic AMP or CAMP. So that's shown with a campfire. And when you increase cyclic AMP, it, like I said, relaxes your bronchial smooth muscles and bronchodilates. So that is shown here by this upside down bronchial tree. We have this tree with a very thick trunk, and so it's dilated, it's opened up. So the drugs in this category, we have vilanterol. So I have the villain from The Incredibles. And so there's different types. You have LABA or long-acting beta agonist, and you have SABA, which is your short-acting beta agonist. So I thought that LABA sounded close enough to lava, and so anything that is a long-acting beta agonist is kind of has lava in the picture. And if you remember from The Incredibles, that movie took place like this villain, his headquarters were in a volcano where there was lava. So that's vilanterol. And then here we have Al, and he's sitting on his butt, or Al butt, or albuterol, and he's wearing a sombrero, or a sabarero, if you will, or Saba. So albuterol is a short-acting beta agonist, and he's sitting on a level dock for level buterol, which is also a Saba. And then he is catching a salmon for salmeterol. And the salmon was living in lava, so he came out of the lava. So salmeterol is a long acting. Then over here we have this barrel, and it's, barrels, they usually have like alcohol, something that's like fermenting in them. So like the word fermenting is kind of like formeterol, and that is a LABA. And then we have our formeterol or art form. Well, not only is fishing an art form, but like someone wanted to carve their artwork into the tree over here. And that is also long acting. The adverse effects for all of these are tremors. So I have shown here this fish. He's flipping and flopping out of the water. He's tremoring. And then tachycardia. So back to this carving here, it's a heart, and the arrow that's going through the heart is going straight up and down for increased heart rate, tachycardia. So then we'll move on to our methylxanthine. So xanthine is kind of like a xylophone. So that's why we have a xylophone, and we have this horse here. He is a palomino horse. It's just a type of horse. So palomino for amino phylline. and he is reading the Bible. He's reading theology for theophylline. So the only drug that you need to know about is this theophylline aminophylline, which is a type of methylxanthine. And the mechanism of action is that it inhibits the metabolism of cyclic AMP. So again, I drew some campfires, but I wanted to distinguish the difference between this mechanism of action and this mechanism of action, because this one, it just straight up increases cyclic AMP. So I just have like one big fire. This one inhibits the breakdown of cyclic AMP. So there's just, I have like multiple little tiny ones. I mean, either way, the end result is still the same. You're still going to have increased cyclic AMP. I just wanted to distinguish the difference, the slight difference in mechanism of action. So there's two tiny campfires for this one. And the adverse effects are CNS issues such as seizures. So you can see the horse's brain, and he's got these little seizure symbols around his head, and arrhythmias. So he's like playing the xylophone, and there's music slash arrhythmia notes coming off of it. And this is one of the pro tips. You can test the drug levels, the serum levels in patients, and you want it to be about 8 to 12. And so there are 8 colored keys here on the xylophone, and then these 4 more are all the same color. So 8 to 12 is like your range that you want. So that's that one. And then we do move on to methacholine or provocholine. So for this drawing, I'm using the brand name of provocholine because it looks like provolone cheese. But this is a diagnostic test. It's not used for treatment. And methacholine or provocholine is an inhaled muscarinic cholinergic agonist. So again, muscarinic, cholinergic, those are synonymous with each other. And remember, cholinergic is the opposite of, it's the opposite of your sympathetic nervous system. Cholinergic is your rest, digest, that's your acetylcholine, it's everything slowing down. And if it's an agonist, then it is stimulating those receptors. So I like to think of it as the opposite of this. If we are not relaxing our bronchial muscles, then we are going to be constricting them. So methacholine can induce bronchospasm and secretions in susceptible individuals. So these would be people like who have asthma. You're going to give them the methacholine. If they start having trouble breathing, then you can suspect that they have asthma. And so going back to the picture here to describe the mechanism of action, we have this provolone cheese, and somebody left it out, and it got moldy, and it's stinky. All these little squiggly lines are coming off. And this middle-aged balding dude here walked by, took a big old whiff, he inhaled it, and now he's like, I can't breathe. So that's basically what this is. And you can see he's in the tripod position because he can't breathe. So adverse effects are bronchospasm, like duh, that's kind of the whole point of the test. Headache, so he has these little headache symbols around his head. And then throat itching. I mean, I'm sure if you were to eat moldy cheese, your throat would itch. So think of it like that. So then we have our cholinergic antagonist. So again, cholinergic is slowing things down, but it's an antagonist. It's inhibiting. So it's inhibiting the the parasympathetic nervous system. So it's basically really similar to our beta 2 agonists. It's still going to cause bronchodilation and dry up secretions. Now, this one is kind of dark. So we have ipotropium. I thought ipotropium sounded like someone like tripping over a rope, like you tripped over a rope, tropium. And well, he has the face of Osama bin Laden because Osama SAMA, a short-acting muscarinic antagonist. And we have our Al here because, and now remember, he's not a cholinergic antagonist, but you can have ipratropium by itself, or you can do ipratropium plus albuterol. So that's why I included him in this picture. But remember, he's still got his sombrero on. He's a SABA, a beta agonist, not a cholinergic antagonist. So Osama bin Laden here, he was drinking some Tito's for tiotropium. And we also have Cusco, the llama from Emperor's New Groove. So in that movie, he drank poison or acid and poison. They're the same thing, right? So I thought alkylidinium, if you just remove the L, it looks like acidinium. Anyways, these are both tiotropium and aclinidium are llamas. So of course we have like a little llama here and a llama here. And so ipratropium can come by itself just as an inhaler. So can albuterol, but they can also be nebulized as well. Whereas tiotropium and the aclidinium are only in the form of inhalers, which is why we have an inhaler here. And all cholinergic antagonists have the same adverse effects. They just dry everything up. So dry mouth, dry eyes, constipation. And then we have our corticosteroids. So all corticosteroids reduce inflammation. And this is actually the first time where we saw a little bit more explanation of the mechanism of action. It says it inhibits the conversion of phospholipids to arachidonic acid. So arachidonic sounds like arachnid. So we have a little spider on a tree branch here. But again, all that just means that it's going to reduce inflammation. So we have Buddha on a slide for budesonide, Buddha on a slide. And this is a nebulizer. So he's holding a little nebulizer. We have fluticasone. So fluticasone is just a little tick. And mometasone. So we have mom in the park with her child. So both fluticasone and mometasone are inhaled. And the adverse effects of all of these are cough. So this little child here is hacking up because that's what children do. And then the pro tip, you make sure you want your patients to swish and spit after they use their inhaler to avoid oral candidiasis. And then I don't have them pictured, but just a reminder that you can use other corticosteroids that are not inhalers. They're either parental or sometimes IV, etc. So we have methylprednisolone, which I believe the brand name is Solumedrol, and that's why that was in one of my previous pictures of someone just like saluting. We have prednisone, which I've drawn multiple times, dexamethasone, and all of these have adverse effects of sodium and water retention and then hyperglycemia. Then we have our leukotriene antagonist of montelukast. And this is one we've covered already. So we have a Monte Carlo car. It's white. So Monte Carlo for Monte, and then a white car because it's Lucast or Luco white. So it's a leukotriene D4 antagonist. So D4 is shown here. It's going to reduce inflammation. Adverse effects are headache, which is not shown, our EGPA, which is also not shown, and then neuropsychiatric effects. So I just have a little brain shown on the tire. Then we have omalizumab. So in case you didn't know, the German word for grandma is Oma. So we have a German grandma. She's on this boat next to a mast. And that's because this is a maintenance therapy for preventing asthma attacks. So they're on this like every day. And it binds to IgE so that IgE can't bind to mast cells and basophils. And remember, mast cells and basophils, they release histamine and are responsible for allergic reactions. And so if IgE can't bind to those, well, then it's gonna slow allergic reactions, basically. So adverse effects are injection site reactions. You're gonna have increased viral infection and then anaphylaxis. So even though IgE is responsible for anaphylaxis, and even though this drug is binding to IgE, it's just gonna slow down the rate of allergic reaction. It doesn't totally stop it. And so you can still have anaphylaxis to this, you can still have a reaction to this drug. And then we have roflumilast. So I thought this was like a roof that lasts. So we have a house. Well, this side of the roof did not last because it's broken, the shingles are falling off. But this side of the roof, it did last. It could weather the storm. So this is an anti-inflammatory. It prevents COPD exacerbation, and it is a phosphodiesterase 4 inhibitor. So I have that shown PDE4. There are 4 shingles that fell off of the roof that did not last. And then our adverse effects are shown here. So we have this psych patient who escaped from the hospital, and he thought that it would be awesome to take his bedpan and take a dump in this person's yard. So, psychiatric effects. We have our escaped psych patient. GI, he thought it'd be cool to take a dump in this person's yard, and he is like super proud of himself for doing that. He's given us a thumbs up. He's got a little tear. He's like, I did it. I pooped. So he's hypersensitivity, like he's sensitive about his feelings, I guess. So that is all I have for now.